you're going to see bruises on babies that maybe make you nervous. Click marks from car seats.
I see marks and I'm like, why is she getting this? What happened?
Yeah, click
Did you
marks
do
from the car
something?
seats, and they don't realize that the car seat, the center thing adjusts. So, first time moms do things to their babies that they really don't mean to, and isn't abuse. So you have to really say, okay, so how'd she get this, and try not to be, how'd she get that? How'd she get this one? Because car seats are dangerous. Because I've seen babies with the click. Have you pinched your baby?
I dumped her out of her car seat. I mean, dropped her on the floor and she went rolling. I've dropped her. I tell
And it
her
happens.
every time I
That's
go
like
that
the
I
doctor
need
who
her.
left his child in the car last week. Did you guys hear about that one?
Oh yeah.
Poor doctor left his child in his car.
Didn't realize the kid was in the car.
Forgot, got distracted.
Yeah.
Oh wow.
Yeah. So you always,
That's a bad.
as they grow, newborns shouldn't have.
They'll just leave them on the roof.
If they have hip click,
and drive.
it should have
Yeah,
already
that's
been
true.
assessed. But with more and more babies being born at home, midwives are great for deliveries, but they don't always do a good orthopedic assessment.
This is Ortolani. This is
on the test. That's right.
So, and she's a good skinny baby, so she doesn't have real thick thighs or anything. So I've had babies that I've had trouble getting my hands, 2-month-olds, getting my hands, because you really want to cup their knee in the palm of your hand, take your fingers, and then rotate out.
Please leave your shoe.
And then with, I know, I'm going to let you have it back.
She's doing so good.
Head lag, she's pulling, so she's not. Say, okay, you can have your hand back. You want to go back up and we'll go the other way? No? You found mommy. Umbilicus, babies. You're genetically programmed for how they clipped your umbilicus. But your umbilical length and the elasticity is genetic. African American babies have big poochy belly buttons because their umbilical cord isn't as elastic towards the end. There are some studies that are looking at the elasticity of the umbilical cord versus the elasticity of coronary arteries. Is that why we don't react to blood pressure medicines the same way? So, looking for hernias, and she should have a little bitty hernia, and she does. I know, isn't she being good? She has a little bitty hernia. It's okay for them to have diastasis, and the surgeons are not going to repair anything until they're 4. Unless you can feel a pulsating bowel, unless you can actually see, because it's just gotten so thin, you can actually see the bowel in there. I've had a couple of those. Or constipation, chronic constipation that you just can't control. And, I've actually had to admit kids to treat them for constipation.